Hello, Mike Jones, Fire Chief and Emergency Manager for the City of Fredericksburg. Here again with you today to bring you a weekly series about the COVID-19 pandemic and the things that are currently going on in our region, the state, and our local area here in Fredericksburg. While the news has not been very positive over the last several months related to the COVID-19 and the new Delta variant portion of the virus, there are some positive things that we will talk about. But let's talk about the numbers first. If you'll go back to June 22nd of 2021, at that time there were only 4 COVID patients in area hospitals and the percent positivity in the community was 1.7%. Very good numbers, and things looked up as some of the local social distancing and other situations were taken into account. Things started to open back up. That, coupled with the Delta variant becoming populous not only in the United States but in Virginia, caused those numbers to go downhill. As of this weekend, we're now at 10.7% positivity in the Rappahannock region, and we have 53 people in the hospital. So that's quite a problem area right there. Also, vaccinations have slowed quite a bit, as we're still only at 57% people above the age of 18 in the city of Fredericksburg that have at least 1 dose of the vaccine. So getting vaccinated is very important. Finishing your vaccination regimen is very important. If you haven't gotten vaccinated, please consider getting vaccinated, because it's what's going to help break this virus and these cycles of the variants that come out. Talking about numbers, they increased statewide. Statewide percent positivity is now 9.5%, up from below 2% back in June. The number of people in ICU and hospitals throughout the Commonwealth has increased by over 100 in the last 2 weeks, and the number of people in the hospitals in the Commonwealth of Virginia throughout the state has increased by over 500 in 2 weeks. So the virus is still among us, it's still out there, and we need to make sure that we take it seriously and that we do all we can to mitigate these problems. So what can we do? 1, get vaccinated. If you haven't been vaccinated, get vaccinated. 2, if you've been vaccinated or if you haven't been vaccinated, we urge you to consider wearing a mask in all indoor settings and in large crowds outside. That way it gives you a preventative measure to be able to try to prevent you from getting COVID-19 from those that may have the virus and don't know it. And then good hand washing techniques and social distancing always help. If you can stay away from people and not necessarily right up close to them, and you can wash your hands on a regular basis, those are always good hygiene and healthy habits to get involved with. Some good news for us. As of this morning, the FDA has approved the Pfizer vaccine for full approval through the FDA, so it is no longer on an emergency use authorization. So the Pfizer vaccine is fully approved for COVID-19 by the FDA. The Moderna and J&J vaccines are still under emergency use authorization, but they are working quickly to try to become fully approved by the FDA. So that is good news on the vaccine front as far as having those developed. We'll continue to provide you a weekly series of updates and things that are going on related to COVID-19 and the virus and how it goes. But those are the information that we have for you today. We'll see you again next week.